Good evening and thank you and welcome for the first Elite Aesthetic Institute webinar. And also thank you for Meditread company and their reps for inviting you at this webinar. This evening we're talking about the use of the Zeus plasma skin regeneration and the effect of the plasma treatment in all kinds of skin condition. If you have some question, any question, you text us, and at the end of the presentation, I will answer you. Since the early 20th century, electricity has been used in the treatment in the medicine and the surgery. The thermal electrosurgery encompasses the technique in which heat generated by the passage of high frequency currents enables living tissue to be incised and coagulated. And in the 1926, Wade produced the first generator capable of providing a cutting current and calling the device endothermic knife. The credit for the popularity of the diathermy surgery is due to Bowie, who in 1928 described an instrument in which cutting and coagulation function could be combined to control the bleeding during the electrosurgery. All in 1914, Greenwood produced an important accessory, the bipolar forceps. For this use of this forceps, the had blades which were electrically insulated from each other and were connected to both outputs to the diathermic generator. This technique of bipolar coagulation changing completely the surgery and become indispensable in the use in the micro and the neurosurgery. So the electrosurgery is an empirical technique. It's not up to undergraduate level, and even in specialist training, it is difficult to acquire the experience necessary to take full advantage of the technique available. And what is the real effect of diathermy is high frequency current oscillating for the tissue resistance and making only hits. This is the 1893, so very old theoretical created about Dansoval. So diathermia is a combine of Latin name is dia, true, thermos, heat. So the combine, the surface of application of the current are fundamental for this effect of diathermia. So the surgical diathermia, when you have a combine, if you combine coagulation cutting with a small electrode, this is Riviere 19, at the same power, we have a greater damaging effect. So we create this effect, this is the name of fulguration of lightning. With this lighting, we create a superficial carbonization induced by high frequency single terminal current of high voltage and low current. It creates an electrical arch which uses ionized air that is between the electrode and the surface of the tissue without the contact. So the electrode is placed next to the tissue, allowing the spring of a spark between the electrode and the surface of the tissue. The interactive air is ionizing, becoming more conductive and keeps the spark. So they currently know as plasma flow. So what is the plasma? We're talking the plasma flow is a dermal sublimation with a voltaic arc, localized carbonization with a very limited damage of the surrounding tissue. We need to explain what is really the plasma. The plasma is the fourth state of the matter, is gas-like state of matter composed of ionized atoms. The ionization occurs when sufficient energy is applied to the gas so that electrons can escape from their atoms, leaving the atoms positively charged. When the electron is recaptured by a positively charged atom, energy is emitted or stored by vibration and the rotation of the gas molecule. This is the imaging, but this is really the plasma effect. We have the electrode near to the skin, no contact with the skin. We create this plasma arch, and we have a small, very small burning in the skin, and this burning in the skin create a tiny effect under the skin. So what is the Zeus plasma skin regeneration? Is working by converting electrical energy into electrostatic energy, which is transmitted to the probe by impulse at about 1 millimeter from the skin. Oxygen and nitrogen are mixed to produce an arc of plasma which discharges onto the epidermis. This creates an effect. The effect is an immediate contraction of the skin tissue and also thermal disruption within the dermis. They stimulating collagen production for the next 5 months and also actives and release other important collagen fibers in the dermis. So we have new skin booster effect. This is the device when you can see different button and different kind of regulation. Is a variable frequency from 25 to 17 kilohertz in 6 steps. Have a signal type is a sinusoidal pulse with variable duty cycle, and 2 different out power, low and high power, 3 and 6 watt, and different color of sign. So the bottom in the up, it's for the frequency variable for 25 to 75 kilohertz in 6 steps. The bottom regulator is for the duty cycle, and the 2 holes, the black one and the red one. The black one is for low power, and the 6 watt is for the high power. So what is important that this device offers? The use of the duty cycle is the possibility to the variation, the different kind of time of the impulse and the pulse. So when we have a small impulse and a long pause, we have a coagulation effect. When you stay 80%, we have a long pulse, a small pause, we have a cutting effect. This give you the option to use the different regulation of 20% to 80% of the duty cycle with different action in the different skin conditions. So with lower frequency, we have a less invasive reaction. So we can use it with the regulation with a very low power, create working in different kinds of skin. So we can use a modulation for the different phototype, the different skin hydratation, the cutaneous thickness is different, the area to be treated, and the type of skin imperfection we're working. So we have 3 different types of procedure thanks to use of this regulation. We can perform it depending on the combination of the duty cycle, the frequency, the kind of tip used, and the method of use. thanks at this kind of combined, we have three different techniques. One is the pinpoint matrix, the second one is the micro resurfacing, and three is the control vaporize. When we're talking about the pinpoint matrix, we can use it for a really skin booster effect. We can be working for no surgical blepharoplasty, for fine wrinkle treatment, for skin tightening, or for microcoagulation for telangiectasia or capillary. In the case of a blepharoplasty, this is the pinpoint is possible use when we don't want to create a surgery. Of course, this patient is not the ideal candidate for this kind of technique, but she's an older patient with a lot of hair failure problems. We can have a surgical procedure, but she wants to have a reduce of the excess of the skin. My suggestion is every time to work in the same of the plastic approach, plastic surgical approach, we marking the area of the surgical blepharoplasty when we were doing working. In this case, we're working all with skin with topical anesthesia, so with a Nambi, no infiltration. But if you want a good effect, it's possible use local anesthesia with lido injection with cannula. I suggest the column protocol. The column protocol is we create a triangle technique, so we create a lifting up of the skin. You see this small dot, we create this very white, it's not burning a lot. When you see the lightening, the really effect of the Zeus. When you have the no presence of the lightening, you have no result. This is a pinpoint pinch, a technique I suggest for lifting up the lateral part of the brow. I don't suggest to go inside of the wrinkle, but go laterally to the wrinkle. Of course, for have the result, you see the lightening. I don't touch the skin. When the tip remains the 1 millimeter near to the skin, you have the plasma effect. This immediately after, it's not big damage. It's only this small dot. Of course, these patients have a good lifting, but this is not the ideal candidate. This one is another option for, in my personal working, I'm a plastic surgeon. One day doing the blepharoplasty, I reduce my incision. I don't go out of the light. I remain inside, and all after 1 month with the pinpoint technique, I lifting the lateral side of the wall. In this case, this is a woman doing the surgery, the blepharoplasty 5 years ago, and I, with the parallel pinpoint technique, I create a contraction of the skin. I lifting more up the light, but at the same time, I reduce the effect of the scar. Is the same pinpoint pinpoint technique. At the same time, I work in this patient for the reduce of the fine wrinkle. I pinch the skin. I work in parallel. We don't go inside of the wrinkle, but we stay parallel to the wrinkle. So we create new collagen fiber for have the reducing of the volume. This is a patient we're doing a combined technique with the upper surgical blepharoplasty, the lower surgical blepharoplasty, and the small wrinkle, the crossfit, and the small wrinkle around to the eyes. This is before, immediately the day after the treatment. This after 3 weeks. This only with Zeus, no Botox, no filler, nothing. All during one training, we use this technique. You see the result after 3 weeks, where it's evident the lifting up of the skin in the upper eye. At the same time, you see the really reduction of the crossfit, and you see in the right side, in the immediately after, only the burning is very low, is no high hyperchromia. And the other side, the same, you see a very really lifting, a reduce of the skin, and Of course, my suggestion is we don't do in the surgery. We have a different kind of skin. I suggest to don't doing only one treatment, but repeat the treatment with a low power, low downtime, and sure low risk of side effect of hyperchromia. So I make one treatment with a low power, the low downtime, and repeat the procedure 2-3 times more after 4-6 weeks. When 4 weeks, when 6 weeks. When I have a skin white, you can wait less time. When you have a dark skin, very 5 or 6 of level of skin, I suggest to wait more time. And in my patient, I don't talking about the treatment, but the procedure, but I'm talking at all the protocol of treatment. So I decided for reduce my risk in a skin, very dark skin, probably I use 4 sessions in 6 months. In a good skin, a younger skin, probably in 2 sessions, have the result after only 2 sessions. In the same patient, have a lesion inside of the eyes connected to the cholesterol deposit, and I remove the same of this only in 1 single session of treatment. This is a patient we see only 1 treatment, and this in the left side after 2 weeks after the treatment, and the right side only after 4 weeks. This patient is very happy for this result. It's no surgical procedure. Of course, with surgical procedure, the result is more better, but he's so happy, she decided to repeat one other procedure. Other pinpoint technique is possible to use it for the vessel. In this case, you have an angioma in the skin. I treat it with the technique. What is the regulation of the combine of my device? I use it the good duty cycle with low impulse, long pause, so have a coagulation effect. And at the same time, I use it the high frequency because I need a very strong power. You see the lighting is very strong, and this patient too, it's we can see without kind of anesthesia. Of course, for close the vessel, I need to arrive on the coagulation of the blood inside of the vessel. In this point, you see the bleeding. I arrive in the end of the vessel, have the coagulation. What is my suggestion in this kind of treatment? Don't working aggressive. You can close the vessel, but I suggest to follow up the patient after 3 weeks, and possible you repeat the procedure for assure the closure of the vessel. This is the treatment for telangiectasia in the face. In this case, it's very possible to see what with single spot, and we follow the vessel. We have the closure of the vessel. You see, it's very simple. It's the same of the treatment with NDAC laser, but with less price for us and very less aggressive for the patient, and with a 0 downtime. I suggest in this case the same, don't aggressive, don't go deeper, and possible repeat the procedure after 3-4 weeks. Now we're talking about the micro resurfacing. So it's possible. This is a new protocol with a new kind of tip, and it's possible user for the smoker line, for the tech neck, rhinophyma, for keratosis, or lentigo. In this case, we're working with a really micro resurfacing. At example, in this patient for the smoker line, I create the dermabrasion, controlled dermabrasion, with remove all the superficial part of the skin. It's a very simple procedure. In this video, you can see the movement of the lip. It's not pain. It's connected, simple, at the reaction of the electricity under the skin. I create an hashtag technique, so I go vertically, horizontally. I remove all the superficial part of the face, and no scabbing effect. Sometimes in patients we have a very deeper wrinkle, I can combine with a soft peel in the same session with a very good result in the time. You see the patient, in this case, of course, I use NAMBI local anesthesia with Lido with the lip lock. This is a new tip of the company, is a loop. You see the loop, and you see up to the loop is very gentle. You see working all when you see the lightening, and you see the skin up the tip. So it's very good result. This is the patient after the treatment, and this is the patient after 12 months. Only one session, no other kind of treatment. You can see the very good result and the very superficial skin, no reddening or a small reddening in the middle of the nose. These patients, I'm very happy to present this case because this patient is a patient with a breast cancer, with chemotherapy, with the radiation, with hormonal therapy, have a very deep, and a smoker, is a very deeper wrinkle. I gave the treatment, but my option is not aggressive approach, but in 3 sessions, and this result after 12 months, I think is a very good result for this patient. And the same with the micro resurfacing keratosis with a loop tip, it's possible to remove this keratosis. This is a very keratosis ablation. It's very simple procedure, very faster. Without anesthesia, I create a abrasion of the keratosis without scabbing on the skin, and the result is immediately in 1 session in probably 20 seconds. This is what can add respect a normal electrosurgery with unbarning. You see the red of the skin is very superficially with kind of deeping barning. And the conclusion, the control at vaporize, is for different skin condition. It's for skin tags, for molds, epidermal lesion, central asthma, warts, scars. Of course, we probably in our clinic, we have other kind of device, laser and CO2 laser, NDL laser, or other kind of product. But what is the advantage of the use of this device? It's very simple to use, and at the same time it's possible to use for a lot of procedure with very cheaper price for us, because there's no expensive device except the traditional laser. So is why the name control vaporize, because with the plasma effect, we don't go deeper in the skin. We can create no diffusion of the heat around to the skin, and with very less risk of scar. In this patient, we have the fibroma, highlight fibroma. These patients, the same, without anesthesia. You see the contraction of the movement of the highlight, but it's only connected, not the pain, but the electricity conduction. In this case, I changing my position, I pinch little bit, stretch little bit the skin, and the patient don't feel the move less the highlight. Of course, sometimes it's possible when the patient feel pain, it's possible to use small local anesthesia. This is before and after, immediately after, and this is the result after 2 months. We see no 0% of risk of scar. The same, my suggestion is, you have a fibroma, you have a mole, don't go deeper. You're talking with your patient, or use the vaporize technique, or use the micro resurfacing. Tell your patient, I stay little superficially. Probably we need to have a second session for remove completely lesion. In this case, after 3-4 weeks, you have the new follow-up in the patient. But sure, we have not any kind of scar. In conclusion, so I have a long time for discussion. We have what is the competitor about the Zeus is plasma pen, subnovi, or other plasma device, and defricator. For the plasma pen subnovi, what is the advantage of Zeus to respect this kind of device? The other device is battery powered, is only one setting, have not a DOT cycle, only one type of tape, and important, no surgical tape. Bifurcator is the older one product, but it's a more similarly coagulator, normal traditional electrosurgery with no, we don't need the negative plate, but is a very strong fulguration effect. It's very painful for the patient, and at the same time, this is very important. We have not the control of the heat diffusion. So the battery, what is the problem with the battery power? The battery does not allow the same power emission for the entire treatment if the battery is not always keep charging to the maximum. So after 1-2 treatment, you need to recharging the battery. But only one setting, of course, we don't not allow modulating the power and aggressivity of the procedure. One tape, one setting, one only kind of reaction. So it's not possible modulating this power. The only one type of tape, the use of one type of tape allow only one type of technique. We can use the 3 technique I talking before, the pinpoint, the micro resurfacing, and the vaporized technique, because we have only one kind of tape. And in conclusion, but it is for me the most important for talking about surgery, with the use of a non-surgical metal tape, a residue of metal powder will remain on the skin. This may cause of foreign body reaction over time. So it's important. Probably our patient in the future can find some kind of problem under the skin with scar. So I think I explained everything about this kind of device. Of course, our school, the Elite Aesthetic Institute, doing the training in combined with the Medithread. If you you buy the Zeus, we create a training for all the kind of method. I create a book, a manual with all the kind of technique, with the setting for all kind of effect. Okay, here some question. Okay. Okay, so have some question. Is all clear of the discussion? I'm here ready for answering you. Okay, one question is about the price for the single procedure. Of course, this depends of in our area of working. But my suggestion, my personal experience, I don't talking about one single procedure, but I talking about all the protocol. For example, my personal experience, the procedure for the blepharoplasty, I suggest to pay one patient, tell a patient my price is 1,000, 1,500, depend of the area, and the patients when come to the control of the follow-up, and they decided 2, 3, or 4 sessions. Okay, what is the one question is the difference with plasma fibroblast? I told you before, the plasma fibroblast is the same of plasma pen. Is all the different name, is one device with only one kind of regulation, with no surgical tip and no with electrical charging. So it's one device with limited action. So my personal experience around the United States, I'm training for other company, and I see patient that use the plasma. It's very aggressive, it's very burning in the skin, and the downtime is very long. And of course, don't forget, more burning, more risk of hyperchromia. Okay, the cost of the device, it's no. The cost of the device is no. I'm training. I know that the distributor of the device, you can sell a mail if you are your reps on the company, but I think it's more or less $5,000. I'm not sure 100%. Okay, another question is about the smoker line and the technique. Of course, for the smoker line, I suggest no only one session. And when the quality of the skin is good, is in a younger woman, I suggest possible to combine with other technique, at example, with the use of the peel. I personally use mandelic peel because it's not aggressive, and I can use it after after the remove the first superficial part of the skin. I can use the mandelic acid with a less risk, but I arrive in the white frost. We know the mandelic acid don't create the white frost, but in this case, when you remove the superficial part, the corneal line of the skin, I can have the white peel, the white frost. Okay, the one is how have hard plasma treatments can cause a good deal of post-procedure swelling. Is your experience? No, absolutely. That's why I prefer the use of the Zeus, because I prefer that is simple in the blepharoplasty, upper and lower, in 90% of cases or 70% of cases, I divided in 2 times the technique. 1 week the upper highlights and the week after the lower highlights. And the same times I work with the lower power. You've seen that during the video, it's only white tip, the white dots, not dark dot, and don't deeper under the skin. And the swelling, it's all for the first 2-3 days. And the same times I suggest, and the company probably have, I don't know, I might suggest the company combine with a post-care treatment. So the patient after treatment has its is a very good downtime. Yes, I use it for all type of skin. Why? Because I use it at different settings. So at dark skin, I use a very low power, a low frequency, and I suggest the patient to come back after, no before, after 6 weeks. 6 weeks. So I give time for the healing of the skin. Okay. No, I have received a treatment with called the Elite result and had my upper lats and cross-take. Okay. I haven't treatment. If you, I don't, for respect to the other device, because I'm talking about the Zeus, not better than the company or the device. I have treated one patient 6 months ago. If you want in private, when you ask me a mail, I send you the picture of the treatment before and after, immediately and after, the day after, and after 1 week of one patient have treated 6 months before with the plasma and after with Zeus treatment. The result is completely different, and the swelling is very is not present in the treatment of Zeus, and the patient is very happy of result. The company, the clinic buy the device, but it's a good question, of course. I repeat, my question is, my question is, I suggest every time to don't working aggressive. This is my very important point. If you're working aggressive, you create, you go deeper, you have a burning of the skin, and the patient is not happy. So don't talking about one procedure. You come one end result. Some days ago, during one webinar for another device, we talking one session, result only from one session, and the price is similar of a blepharoplasty. Of course, this is not surgical blepharoplasty. It's a medical blepharoplasty. It's a non-surgical, no aggressive procedure. So we need to, it's important for all our treatment. When you're talking about the treatment with filler, with thread, with Botox, the first step is selection of the patient. So we need, my first video is the bad patient for this kind of treatment, the bad, because it's a patient with a very excess of skin, edema, with the back fat inside of the eyes. So this is not the ideal candidate for the good results. Okay, so I have other questions. I use this webinar for talking about the Elite Aesthetic Institute. It's a school based in Boston. We have a different kind of training, injectable laser, thread, and lipofilling. And this training is possible is with hands-on training, with private hands-on training or group training, and with a lot of webinar is possible, and is possible with and without continuous education. Okay, so I have no other question. I thank you for stay with us this evening, and I'm ready for any question, other question or suggestion, and with my email or the email of the Elite Aesthetics or your reps, and if we want, it's possible have this presentation to see this webinar in the future when you question us. Okay. Good evening. Thank you.